Assalamu alaikum. My name is Dr. Ahmed Mushtaba Rashid. I am a pulmonologist and intensivist working in the Denver metro area. I've been asked to make this video because there have been a lot of myths that have been spreading on social media, especially WhatsApp group, about coronavirus and the COVID-19, which is the disease caused by the coronavirus. In this video, I will try to debunk some of those myths and some of those misconceptions. I have taken care of patients who have COVID-19 and also have been working closely with my friends who are pulmonologists and intensivists around the world to get more information about this disease and the patterns of spread. So hopefully this video will help you guide through some of the vast amount of information and misinformation that is out there on the internet. First misconception that has been going around is that it will wither with the heat. The summer is around the corner. We will get higher temperatures and the virus will die down as the viruses of common cold die down, because in the end, coronavirus is a type of a common cold virus. It is not true. The previous two novel coronaviruses that have infected humankind in an epidemic were SARS and MERS, SARS and MERS, and both of those viruses were not particularly affected by the seasonality or the heat. It is true that in the lab, the virus did become inactive at about 41 degrees centigrade, but it was not proven in a real live human population. Also, this is a new virus, so we do not have much immunity around it. Most of the common cold viruses die down in the summer because they cannot propagate as efficiently, but also people do have immunity against it. So this may not be true for this virus. The next misconception is that this isolation, the social distancing, the closing of the restaurants and gyms is an overkill. There have not been new cases. There has not been an explosion of cases. But, why are we doing this? This is just going to tank the economy. For those people who believe in this, I'll give you the example of Larry Vaughn. Larry Vaughn was the fictional mayor of a beach town in Florida in the famous movie Jaws. If you have not watched it, you should. It is very fun. It is very scary. So in the movie, the people of town are seeing unusual occurrences, and they believe that there is evidence that there is this big shark that is hunting people down in an unusual pattern. They come to the mayor and ask him to close the beaches. The mayor refuses on the pretext that that will hurt the town's economy. And we all know what happened. If you don't do watch the movie, as I said, it is very, very scary. It is all about flattening the curve. What that means is that you want to limit the number of people that are infected by this virus. Because if you look at the data from Wuhan, China, of every 100 people that got infected by the virus, 5 required ICU care or higher level hospital care. Now, if we go out, keep mingling, and keep interacting with other large groups of people, we will continue to infect more people exponentially. What that would do is, say 10,000 people get infected in a week. 500 of those will presumably need ICU care in the Denver metro area, which will overwhelm the system, which is what happened in Lombardy, Italy. On the other hand, if we do not mingle, if we do not interact, and those 10,000 people get infected over a period of 8 to 10 weeks, it is easier for the healthcare system to take care of the 500 sick people over 10 weeks than during a surge which happens in 1 week. So that is the reason that we do need to flatten the curve. We do need to stay away from each other. We do need to take care of the elderly and those people who have underlying health conditions like diabetes, heart disease, and COPD. Drinking more water and putting water in your nose as we do in wudu is going to help reduce the virus and you will not get sick. Absolutely not true. While keeping yourself hydrated and doing wudu are recommended anyways, the hypothesis that the virus somehow is just clinging to the surfaces in your pharynx and your nose, and when you put water or hot water or salt water in your nose and in your mouth, it will just wash it away and make it go down to the stomach where it will be killed, is not true. The virus is an intracellular particle. It is actually inside of your cells, and it is not going to be washed away by large amounts of water, salt water, or hair dryer in your mouth, as some people have suggested that we do. That is just going to burn your throat and cause you to be even sicker than if you did get coronavirus. So be careful about those myths. The next thing I hear is that if you don't have fever, you cannot have coronavirus. You can. You can be a carrier. The symptoms of this virus are variable. You can have a cough, mostly a dry cough. You can have nasal congestion. You can have post-nasal drip. You can even have stomach symptoms like an upset stomach, like diarrhea, like vomiting. Fever and shortness of breath are actually symptoms to be aware of, symptoms to be wary of, and especially if you start getting short of breath, that is when you do need to seek healthcare advice and go to a hospital or call your primary care provider. Otherwise, you can isolate yourself in home, and we will touch a little bit on that later on and in some of the upcoming videos. It spreads through the mosquitoes. It absolutely does not. Other viruses like dengue do spread through mosquitoes. This one just spreads through droplets and airborne particles that can be transmitted from your mouth and nose onto your hands, onto the other surfaces, especially the stainless steel and the solid surfaces where it has been shown to live for long periods of time. And then other people can touch their hands, take them to your mouth, and then they can get infected or become carriers. So, but it does not spread through other vectors like flies or mosquitoes. I've also been hearing that people are saying hand sanitizers are better than soap to wash your hands with. It is absolutely not correct. Soap, even the homemade soap that people use in villages back home, is better at protecting and cleaning your hands and cleaning away this virus because it has carbolic acid in it, and that does dissolve the lipid layer that surrounds the virus and washes it away better than the hand sanitizers. Now, obviously, you cannot wash your hands while you're in your car or you're in a grocery store all the time, so that is where hand sanitizers come in. But wash your hands with soap for about 20 seconds, and that is the best prevention at this point in time. Garlic. I have heard so many things about garlic and ginger and rosemary and olive oil and Karela oil and whatnot, that will just cure the virus, prevent it from happening. There is no scientific evidence on that, guys, and it could be harmful in some people if they start drinking drinking olive oil, especially. Now, garlic, it is true that the garlic and the olive oil and all these natural substances have some antioxidant properties, and it can make the inflammation better. It is not going to prevent you from coronavirus. It is not going to cure the coronavirus or the COVID-19. It may make your breath smell so bad that other people won't come near you, and then you will be protected from contracting it. But I do not think that is a very attractive solution to prevent you from getting this disease. Children are safe. To some extent, this is true. In most of the data that we have available from China, less so from Italy, younger children seem to have a more plastic, more adaptable immune systems, and they do not get sick as adults. For example, of the 80,000 people that were infected in Wuhan, only one child needed ICU care. But here's the caveat: the children are very effective carriers. Since they don't become sick, they can have virus living in their noses, in their mouths, in their pharynx, and if they go out and mingle amongst other children, they can easily pick it up, bring it back home, and transmit it to their grandparents, to their uncles and aunts who have health conditions or who are elderly, and they have a potential of becoming very, very sick. So please keep your children isolated as well and keep them safe, keep the rest of the community safe as well. It is an international conspiracy. If you go on the Chinese internet, it is exploded by how Americans have actually propagated this virus to actually, derail the Chinese economy. If you go on the Iranian internet, it is also saying that this is just punishing Iran. US here, all the slurs about the Chinese virus. But, honestly, these pandemics have happened throughout the history of mankind. They will keep on happening till the end of time. There is no evidence to suggest that this is an international conspiracy. These are some of the reliable information sources that you can use. There's a CDC website. There's a great website by National Jewish Health here in Denver, and also the WHO website. Please confirm anything that you read on these websites, because there is a lot of misinformation going along. In the end, keep your distance. This is a back of a garbage truck in Pakistan that says basically, if you come any closer, we'll fall in love. I love you guys, but I also want to keep your distance during these trying times. Please stay safe. Please keep washing your hands. Thank you, and Allah Hafiz.